So today's topic is urinary, isn't it? So it can be an essay question. So urinary bladder, as you can see in the picture, it's a hollow muscular bag. You can see this is a hollow musculo-membranous sac which acts as a reservoir for urine. So when you have seen the cut section of the pelvis, again I will show you. Just behind the pubic symphysis, we will see urinary bladder. It is subperitoneal organ. That means it is present below the peritoneum. I will show how the parietal peritoneum is reflecting. And the urine enters the urinary bladder via ureters, and the urine exits out through the urinary bladder via this urethra. Okay? Then, so we will take the help of diagram so that you will understand better. So first I am checking for a transfer section if it is there or not. Mm, yeah, this is the section which I am trying to, but I'll try to see. Yeah, see here, beta. So first of all, in order to understand the location of urinary bladder, we should understand this picture. So this is the sagittal section. I have been always telling you, like head and neck. Yesterday we saw pharynx, larynx, right? It was sagittal section. Similarly, this is also body sagittal section, where you are finding this is front pubic symphysis. Behind we have sacrum, right? Coccyx. So immediately behind pubic symphysis, we have urinary bladder. Okay. And in case of females, behind the urinary bladder, we have uterus. Because now this is male pelvis, you are finding immediately behind the urinary bladder, rectum and anal canal. Now we have studied like urinary bladder is present below peritoneum, subperitoneal. What does it mean? Peritoneum, this green line is situated above the urinary bladder. It is forming a fold between the urinary bladder and rectum anal canal. The name of this pouch is rectovesical pouch, not retro, it is rectum, rectovesical pouch. Okay. Now when you see this picture, you need to understand many features of urinary bladder. It will be 3D picture. In order to understand, you have to little imagine also. See this surface which is above, you call as superior surface. This surface which is below, you call it as inferolateral surface. This surface which is behind, you call it as posterior surface, also called as base. And this area is neck of the urinary bladder. At the neck of the urinary bladder in males, we have a gland called as prostate gland. This point where this violet line is shown, that is actually apex of the urinary bladder, apex. So I'm telling again, now the presenting parts what we see: superior surface, two inferolateral surfaces we will have, because it is mid sagittal section. Like brain, if you cut it one half, the other half is also there. Similarly, we have two inferolateral surfaces. This is one inferolateral surface, this is one more inferolateral surface. Okay. So inferolateral surface, superior surface will be like this, uniform. Then this is behind, which is called as base. One more name is posterior surface. What is this area? Neck. What is this area? Apex. At the neck, what gland do we have? Prostate gland. And this is the apex where we have median umbilical ligament. Okay. So anteriorly, the inferolateral surface is related to which organ? Pubic symphysis. And this space, which is free space here, actually this is called as retropubic space. Retro word always indicates behind. Yesterday when I was talking about kidney, I told you it is retroperitoneal. Retro means it is behind. Okay, beta? That is. You need to keep this picture in mind. Now, what is this pelvis we are seeing? This is the female pelvis. So in the female pelvis, see, this is pubic symphysis. Just behind pubic symphysis, we have urinary bladder. Okay. And in case of females, behind the urinary bladder, we find uterus. Behind the uterus, we find rectum and anal canal. This green line is indicating peritoneal reflection. So the fold of peritoneum between urinary bladder and uterus, you call it as vesico-uterine pouch. Vesico-uterine pouch. And the fold of peritoneum between the uterus and rectum, We call it as rectovesical pouch. Rectovesical pouch. Okay. Are you understanding, Niharika? Is that clear what I am telling?
Yes, ma'am.
Everybody is able to understand urinary bladder? I am talking about position, then we will go to dimensions and presenting parts. So this picture I'll take you later. Okay, let's go back now. So this picture, what I have told you now, should you should keep in mind. Otherwise, it becomes little difficult for us to imagine without diagrams. Okay. Mm. Now see here. So so this slide we have finished. So anatomical location. Where is this urinary bladder located in the pelvic cavity? That special area is called as lesser pelvis. Behind which bone? You can tell more specifically in
Very
pubic symphysis. Okay, so basically the lower pelvis is called as lesser pelvis. When the bladder is full, it comes up. So that particular area of pelvis is called as greater pelvis. Okay, so when the urinary bladder is too full, it may come up to umbilicus also. Okay, so in infants, because the pubic bones are not yet so much well developed, urinary bladder is actually abdominal organ. Okay, and it usually enters the greater pelvis by the age of 6 years. Now, what are the presenting parts? See this surface which I told you, which is like this, right? So this whole entire surface which is above, you call as superior surface. On either side, I said we have one inferolateral surface and other inferolateral surface. One side you are shown here, the other side will be the inferolateral surface. This is the other side which is shown. That means this is apex, where that violet line was there, no? We are seeing from the other side, but that's it. Apex of the urinary bladder. What is this area? The most dependent part? Neck. In case of males, what do we have in the neck? Prostate gland. Prostate gland. Okay. So you are seeing one superior surface and two inferolateral surface. Behind, I said posterior surface, also called as base. Now in this picture, we will be also able to see the borders. Now what are the borders we have? We have two lateral borders. This is one lateral border like this. This is one lateral border. This is one more lateral border. Okay. See, these are the two lateral borders. From apex, if you take behind, two lateral borders, and behind you will see this is the posterior border. Okay. Joining two inferolateral surfaces down, you will have one anterior border also. Anterior border. So I'm repeating borders again. See, this is one lateral border. This is one more lateral border. This is the posterior border. And in front, you will have one anterior border, which connects two inferolateral surfaces. In the midline, we will have anterior border. Okay, beta? Superior surface, two inferolateral surfaces, behind is posterior surface. The borders are two lateral borders, posterior border and anterior border. Okay. Same thing will be told here. It will have superior surface, right inferolateral surface, left inferolateral surface, posterior surface. I have shown you before I have gone to the points so that you should not have any confusion. When you just see the cut section of urinary bladder, you will see it is lined with transitional epithelium. So transitional epithelium is the epithelium which will have multiple layers, and the top row usually is made up of cuboidal and umbrella shaped cells. Okay, when the urinary bladder is empty, but when urinary bladder is full of urine, it gets stretched. So the upper umbrella polyhedral cells, they get stretched and the epithelium becomes squamous. That means from the cuboidal columnar, it is changing to squamous type. So such changing epithelium is called transitional epithelium. Okay, we know urinary bladder holds urine before it is voided. How much it can hold? 400 to 1000 ml. Okay, so it is located between the apex and the, see, this is the, that violet line I said, no, that is apex. See, this is the apex and this is like neck. So in between, whole of this is the urinary bladder. Okay, now this is the cut section of urinary bladder where we are seeing the inside. Is it male bladder or female bladder? How do we recognize? This is male urinary bladder because we are finding prostate gland. So in the cut section, you are finding the inside of the urinary bladder is completely smooth and it is showing folds like we see in stomach, rugae. Similarly, here also you call them as rugae only, but there is one area which is triangular and it is not showing any mucosal folds. This particular area is actually called as trigone. Trigone. And you are finding two holes over here. These holes are nothing but ureteric openings. We have seen two ureters were opening, no? So this is the inside view. The two ureters are opening on either side of trigone. The ureters will be bringing the urine from kidney. Ureters will come here. Here kidney, the ureters are coming like this. Okay. So the space between the two ureters, the distance between the two ureters is actually called as interureteric ridge. Interureteric ridge. One more name is given called as bar of Mercier. Bar of Mercier. Okay, when the urinary bladder is full of urine, the distance between these two will be 5 centimeters. Okay, Maju, Majuji, and the distance between the two ureteric openings when the bladder is empty, it is 2.5 centimeters. Okay, so now fundus, it is nothing but the base of the urinary bladder, which I said is posterior surface. No, so that is the inside of the urinary bladder. You will see the trigone. Okay, so this area is trigone. Fundus of the urinary bladder is this. Okay. Then we usually do not use fundus in our textbook, okay? But trigone is some. It's very very important. It itself can come as 3 marks or 5 marks question also. So it is smooth triangular part of urinary bladder. It is having the mucosal lining which is smooth and firmly attached. Okay. We have seen on either side water opening, right ureter, left ureter. Their openings are called as orifices. Okay, so this triangle, I said it is interureteric ridge. No, so this is one ureteric opening. This is one more ureteric opening. This length is interureteric ridge or bar of Mercier. Empty bladder, it is 2.5 centimeters. Stretched bladder, the distance is 5 centimeters. Okay. Now see, this is one more 3D picture which we are trying to understand. See, these are the two lateral borders. You can draw this picture. This is the posterior border and this is anterior border. We have two surfaces. One is inferolateral, right and left inferolateral surface. Then this is superior surface. This is neck of the bladder, right? Neck of the bladder. So this is you are seeing from behind. You call it as base, also called as posterior surface. So it will have little like you need to have certain like more imagination because specimen is not in your hands and you didn't even see the dissection properly, isn't it? This is one ureteric opening, this is one more ureteric opening. Okay, so these are the slit like openings. This green line is interureteric ridge, bar of Mercier, I said Mercier's bar. Okay, this is the neck of the urinary bladder, lowest portion through which urethra is starting. This is trigone. Okay, and this is urethra. Urethra in male is passing through which gland? Prostate gland. Hence, the part of the urethra is called prostatic urethra. Prostatic urethra. Okay, then now see here internal urethral sphincter. You will have at this point only. Okay, so internal urethral sphincter, you see this green line has been given for us to understand this muscular sphincter. Muscular urethral sphincter, there you have smooth muscle and the nerve supply is S2, S4. Please remember this point. This is internal urethral sphincter. Okay, so internal urethral sphincter has smooth muscle, okay, located at the junction of urethra and urinary bladder. It is innervated, that means nerve supply is S2 and S2, S3 and S4. Okay, what is the function? Sphincter means it will close tightly unless we are ready for urination, and in case of males also for ejaculation it doesn't open. It is under our voluntary control. Okay, only when we are ready for the act it opens. Okay, that is, this is internal urethric sphincter where we have smooth muscle. Okay, then it constricts the internal urethra also during the process of ejaculation. Usually the semen is not allowed to go back into the urinary bladder because of the presence of this muscle, internal urethral sphincter muscle. Okay. Now basically, if you just observe the cut section of urinary bladder, inside the urinary bladder there is a muscle. The name of this muscle is detrusor muscle. Okay. What is the name of this muscle? Detrusor muscle. It's also called as muscularis propria. Okay. It is a smooth muscle which is found around the wall of the urinary bladder. It has inner and outer longitudinal muscle fibers and middle circular fibers. We will see in the histology. Okay. Inner longitudinal, middle circular, outer longitudinal muscle layers it will have. Okay. That is. Only when we are voiding or passing urine, it contracts. Rest of the times, it is relaxed. This whole muscle is detrusor, detrusor muscle. Okay. Now, let us see. See, this is first. Let us try to understand the picture. This is pubic symphysis. Just behind pubic symphysis, we have urinary bladder, and this is male sagittal section. We know, like, this is the peritoneal fold. Behind the urinary bladder, we have rectum, anal canal, right? Now, see here, certain features are shown. This green gland at the neck of the urinary bladder is prostate, and this violet lining, whatever you are finding behind, is actually there is vas difference. Okay, which comes as a part of the male reproductive system, and then we have, these are seminal vesicles. Behind we will see vas difference and seminal vesicles. They will join to form ejaculatory duct, ejaculatory duct, which opens into prostatic urethra, prostatic urethra. Actually, vas difference brings the semen. Seminal vesicles also will pour the secretions in this ejaculatory duct. Prostatic gland also will release prostatic fluid. So net secretions together you call as semen, which comes out through the urethra, okay, which is passing through the penis. Okay. So when you see in males, behind, what do we see? We see vas difference, we see seminal vesicles, okay. Then we see rectum, okay. Then we have rectovesical fascia and peritoneum. This is in males. In females, behind, you see this is uterus, and then this is vagina. So in females, it is posteriorly related to vagina and a part of uterus. This is the urinary bladder. It is related to part of uterus and vagina. Okay. That is. So this section I have explained you. This is urinary bladder in male. Behind we have rectum. Okay. That is. In case of females, this is urinary bladder, and this is uterus, and then this is vagina. So these are the actually various, like we have studied pelvic diaphragm, if you remember. I told you this muscle is levator ani muscle. Okay. Here we have urogenital diaphragm. So all these are actually giving support from down. Now coming to the blood supply of urinary bladder, we have vesical arteries. Vesica means actually the bladder. So just remember, we have superior vesical arteries and inferior vesical arteries. Just give these two names enough. Superior and inferior vesical arteries. Okay, you need not go much into detail. So this whole thing is posterior abdominal wall. This is lumbar vertebra. Here we have sacrum. Okay, this area is pubic symphysis. Behind pubic symphysis, this is urinary bladder. In females, this is uterus. Behind uterus, in females, this is rectum, anal canal. Okay, this is sacrum bone. This is one ureter, this is one ureter. Okay, so this is right iliac artery, left iliac, common iliac arteries, these are. This is internal iliac artery, this is external iliac artery. Correspondingly, we have internal iliac vein, external iliac vein, common iliac vein. Both common iliac veins will be draining into inferior vena cava. This is psoas major muscle, psoas major. These yellow tubes are ureters, ureters, which are bringing urine to the urinary bladder. This is our urinary bladder. From the sacrum, these are the S1, S2, S3 nerves. They join to form sacral plexus, sciatic nerve. So much information is there in this picture, in fact. Okay, venous drainage, corresponding names you remember better. Superior vesical veins and inferior vesical veins. Okay, they form vesical venous plexus. They will drain into internal iliac vein. Internal iliac vein. Okay. So innervation of urinary bladder, I've shown you in physiology that nerve supply S1, S2, S3. So that is more easy. Like if you read critically also you don't understand. Lymphatic drainage, you have to remember where the lymph nodes, like, see, it is draining into from superior surface of the bladder, external iliac. Okay, then from the fundus, internal iliac. From the neck of the bladder, common iliac group of lymph nodes. Okay, external iliac, internal iliac, common iliac, these words you remember. Okay, so that is all about urinary bladder beta. So I will also show you one more PowerPoint. See, urinary bladder. These are all like theory things. That's the reason I have used that PowerPoint. Netter's Atlas picture. Just now, actually, this picture will help us to understand the male, like sagittal section. You have this is penis, this is scrotum, right? So then, inside the scrotum, this is testis. From the testis, this I was telling, this is vas deferens, which carries the sperms. It is coming behind the urinary bladder. Behind the urinary bladder, we will have seminal vesicles also. At the neck of the urinary bladder, we will see prostate gland. Okay. This is female section. How to see urinary bladder, uterus, rectum, anal canal. Okay. See, this picture is good, better. You will have in much good colorful picture actually. This is the posterior surface of urinary bladder, where we will have like seminal vesicles. These are the two seminal vesicles. Here we will see like vas deferens is coming. Vas deferens and the seminal vesicles together, they form ejaculatory duct. This is the prostate gland. This is superior surface, same superior surface where we have peritoneal covering. Okay, only pictures we will see with them. This is much more beautiful picture of posterior surface. See how vas deferens is coming behind. This is vas deferens. This is ampulla of vas deferens. This is seminal vesicle. This is also seminal vesicle. Vas deferens and seminal vesicles, they are joining to form ejaculatory duct. This ejaculatory duct is opening into the prostatic urethra in males. Prostatic urethra. Okay. So actually there are certain supports and ligaments around the urinary bladder. From the lateral side, you call the ligaments as lateral ligaments. Picture was there, you should have understood better. So this is urinary bladder, no? From the lateral side to the pelvic wall, here you will have lateral ligaments. From behind also you will have posterior ligaments. From front also we will have. We will call them as pubovesical ligaments. Pubovesical ligaments. Okay. These are the ureters. You can see how they are piercing the urinary bladder. This is the trigone area. This is the internal urethral sphincter. Okay, and we see in case of females, we do not have prostate. It directly passes through the urogenital diaphragm. Detrusor is the muscle what we see in the wall of the urinary bladder. Okay, bar of Mercier, I already told. This is different way it has been opened. This is apex. You can clearly see this trigone. Okay, you can see how the ureter is passing. Probe is shown. Okay, this is the ureteric opening. This is the bar of Mercier, also called as interureteric crest. This is the urethra where it is starting. Okay, this triangular area is trigone. Rest of the urinary bladder is showing rugae, mucosal folds, but here you do not find any mucosal folds in trigone. So here also you can see better. The mucosal folds you can see there. You can also see the trigone. This is all mucosal fold. This is trigone area. This is the internal urethral sphincter. Okay. This is the urogenital diaphragm. Here prostate gland is not there because it is females. This is the picture which I have shown you when I was doing levator ani, that is pelvic diaphragm, if you remember. Three organs, one behind the other. Behind pubic symphysis, urinary bladder. This is urethra. Behind like urinary bladder, this is vagina. Continuation of uterus. This is anal canal. Continuation of rectum. These are fibers of right and left levator ani. Do you remember the components? I told you hip bone has three parts, ilium, ischium, pubis. Similarly, you have the names also. Iliococcygeus, ischio-coccygeus, and pubococcygeus are the components of pelvic duct. Cystoscopy, it's a technique where we visualize the internal structure of urinary bladder. Okay. Okay, this is something like summary beta. Epithelium. What type of epithelium we have? Transitional epithelium. Which muscle we have? Detrusor. It has three layers. Inner longitudinal, outer longitudinal, middle circular. Blood supply, superior vesicle and inferior vesical arteries. Other arteries, if you can remember, obturator, inferior gluteal, uterine and vaginal. Veins, I said it is like vesicle venous plexus, isn't it? You can remember that. Internal and external iliac nodes. Nerve supply, sympathetic, actually, like inhibitory. This is like better you read it from the physiology textbook photograph. But Niharika, if possible, please share that photo with. Okay, that's all. Seminal vesicles is a different topic. So, I will share spinal cord now. Right, the vertebral column. So we have cervical vertebrae, thoracic vertebrae, lumbar vertebrae, sacrum, right? So within this vertebral column, we have central hole, that is the vertebral canal. So in the vertebral canal, you will see the spinal cord is passing. The spinal cord extends from the medulla oblongata, which passes out through foramen magnum of skull bone, and then it comes out and it ends at the level of L2, second lumbar vertebra. Okay. After that, you will see these are only spinal nerves. Okay. No. So spinal cord is the lower elongated part of the central nervous system. It is cylindrical in shape, slightly flattened anteroposteriorly. Length is 45 centimeters and weight is 30 grams. Okay. So extension, it is extending from the first cervical vertebra to the first lumbar vertebra. From here till here only you have the spinal cord. See, the lower tapering part is this particular area is like mehendi cone. This is called as conus medullaris. Okay. From here you will see a thin filament continues. You call it as phylum terminale.
Terminal.
Phylum terminale. So now see here positional changes of the spinal cord as the age advances. See, this is during the fetal life. You can see these are the cervical vertebrae. Pink in color is the cervical part of spinal cord. These are thoracic vertebrae. Blue in color is the thoracic part of the spinal cord. Violet is lumbar part of the spinal cord. Green is sacral part of the spinal cord. But during development, the vertebral column keeps growing, but spinal cord stops its growth. Hence, spinal cord is ending here only at the lower border of L1. Okay, link may go better. Please rejoin fast. Okay, I should not call you, please. Okay, so this